It's good. I see it on. All right, and can you share the slides as well? Okay, well, welcome everybody so much to our year-end and Giving Tuesday Town Hall. It's just, again, so much fun to see everybody here and see like faces on the screen. I know we're not in person, but it's yeah, it's just really a pleasure. So I've introduced myself, and Sheku has introduced himself. So we'll, just spend about maybe 15-20 minutes talking about what has happened in 2020, give a little bit of a recap, and then Sheku's going to tell you a bit about what we're looking forward to in 2021. So excited to put the 2020 chapter behind us, so we do have some exciting things to celebrate still. It's definitely been a chaotic year. And then we'll take some time for questions and tell you how you can support OneVillage partners. So recap on 2020. So, we came off of a year where we, for the first time, raised more than $1 million in 2019. So we were really excited to keep the growth going and keep the momentum up. We were celebrating our 10th anniversary, and so have plans to expand to a new geography and also build out new programming. So as many of you know, we communities implement projects at a village level, and our new programming, we were really excited to bring communities together to think about bigger solutions and regional solutions and keep using the skills that they have to design and implement projects to improve people's lives, but on a larger scale. But then COVID hit. And so, we learned so much from the Ebola outbreak, in that we really have a role to play in the network that we have and the trust that we have with our community partners in responding to a crisis. So we worked with communities to find out what they needed, and were able to respond and adapt really quickly to that. We were able to reach more than 30,000 people with our response, getting information out about COVID, really focusing on prevention and mitigation. We worked with a local hospital to establish a quarantine center so that people had a place to separate from their family and communities if they were showing symptoms. And we delivered food to people in quarantine, hand washing stations, masks, and we have still seen 0 cases of COVID in our partner communities, and it's December. And Sierra Leone is one of, I think it's 4 countries on the list of countries in Africa that are considered really low risk right now for COVID. So very different than what we're seeing in the US in terms of day-to-day, but we're just really thankful for all of the early support from our partners who came through and helped us respond really quickly and effectively, so that we can now report the success that we're seeing today. We, despite the early lockdowns and chaos of 2020, we were able to really get things back up and running in July. So the lockdowns in Sierra Leone were lifted, and with adaptations and having, being socially distanced and wearing masks, we were able to get back to more usual programming alongside the COVID response that we were always actively working on and keeping a pulse on. So in our Nurturing Opportunities for Women program, again, with social distancing and masks, our team was able to continue the program as of July, and we are now celebrating 184 graduates who have learned skills in financial literacy and business management. So they are empowered and improving their livelihoods, and we're just really excited to celebrate them this year. In our community action program, there were communities that had programs that were well underway when we had to go into lockdown early in 2020, but they just jumped right back into it. We were very excited that 6 communities completed projects in 2020. 4 of them worked on agriculture productivity projects, so they improved food security for more than 6,000 people. And an additional 3 communities, and 2 that have completed these already, worked on constructing latrines, hand washing stations, and water wells, so have improved sanitation and water facilities for more than 4,000 people. So want to also celebrate them and the success that they've been able to achieve in 2020. the new program I was talking about, the LEAD program that we're piloting to bring communities together to think about bigger and regional solutions, we were able to finish or almost finish two programs or two projects under this program, a community birthing center in Grima and a community skills training center in Bombohun. So really excited to keep that pilot going, and then we're looking forward to scaling that up in 2021, which Sheku will talk more about shortly. And then finally, I talked a little bit about our expansion to a new geography, and we are very excited to have opened our new office in Daru, which is about 1 hour drive east from Bunambu, where our current office was. This is a picture of the new office. We're really excited about the space, and we have officially partnered with one new community from this office. It's the community of Bombohun, and they have a population of a little more than 1,000 people, and we'll be starting a project to improve sanitation and hygiene through latrines and hand washing stations. So we're very excited about this new partnership, and we'll be expanding to additional community partners in the Daru area throughout 2021. So I'm going to turn it over to Sheku to tell you a little bit about what we're looking forward to next year. Sheku, you're muted.
Thank you, Jill, for that. Are you hearing me? Are you hearing me?
Yep, you're
Hello?
good.
Are you?
Go ahead, Sheku.
Yeah. So thank you very much. We are very pleased with what the communities are doing. Amid this global pandemic, we are very pleased, very excited looking into 2021. So 2021 program priorities. One, we will be actually intensively active across 11 new projects next year. The now program will reach out to 200. Overall goal will be to continue to catalyze community-led. We want to look at this and at the program perspective for 2021. Let me begin with the nurturing opportunities for women. The nurturing opportunities for women actually trains women to strengthen their financial skills and also making sure that that will be.
Hey, Sheku. Sheku, I'm going to ask you to stop for a moment. You're
120 train to straight. Pardon?
Sheku, you're breaking up. Can you maybe turn off your video and maybe we'll be able to hear you better?
Okay. Mine.
We can hear you. Just speak slowly, and I'll give you an update. Well, I'll let you know if you're chopping again.
Okay. So as part of priorities for the NOW program will be to train 120 now one participants on how to strengthen their household finances. This will happen in our 3 heritage villages. These are the original villages where Jeff O once lived as a Peace Corps volunteer. And in Bombohun will also be part of the now one training next year, which Bombohun is one of our newest community from our newest regional hub in Dalu. So they will be benefiting from the now one training next year. As part of the now one training next year, we are also going to be targeting 120 participants in now 2 to actually learn business skills across 4 communities. So we are very excited moving into 2021 with over 240 participants that will be directly engaged in now. Moving to the community action program. The community action program actually works with a cohort of volunteers to actually lead development projects across their communities. So this cohort of volunteers are trained on leadership, designing projects, as well as implementing and monitoring their projects. Currently, we have 4 communities that are prepared and ready to begin construction by the beginning, as early as January. These communities are Nyanyao. Nyanyao will be working to improve their birthing center to provide access to improved health service delivery for pregnant women and the general community members. Magwima will also be working on agricultural projects. They will be actually constructing a store where they will try to create access for farmers to safely store their farm produce after every harvest. And in Bandajuma also, they will be working on water wells to provide access to improve safe drinking water for the community year-round. And finally, Bombohun is also ready for implementation as early as January. They will be working on latrines. That is to reduce the prevalences of diarrhea-related sicknesses, especially for children in that particular community. In total, by the end of 2021, we are expecting 8 projects to be completed by our community members. And these 8 projects will directly target the well-being of over 12,000 community members. So we are very, very excited moving into the 2021 with this kind of anticipation of which we will be able to achieve. Moving on to the next program, which is the leadership training program, which the lead program is actually working with cohort of volunteers selected by their communities to the development project. So as early as in 2021, we have 6 communities that will be participating in the lead project. These communities will be working together to identify development projects that expand beyond their individual communities, as well as impacting the surrounding communities and the broader region that they are in. So we are very excited that we will have Pegewa as one of those communities, Maloma as another community, Yandong, Manju, Gulao, and Bika participating in the project, in the lead program. So as early as next year, these communities will be going through lead trainings on community cooperation, proposal writing, budgeting, as well as working together to decide what their proposal would be. Ultimately, OneVillage partners will be selecting 3 proposals for funding and implementation. So to conclude, we are actually very excited about our overview priority for 2021, which is we are working actively in 24 communities. We are actually going to be expecting 11 new projects next year. And the NOW program will be targeting 240 participants next year. And our overall goal will be to continue to catalyze community-led development with our partner communities. Do you hear me?
All right. Thank you so much, Sheku. So we're gonna stop with a kind of official presentation there, and then we can take questions from those on the line. If you would like, you can put them in the chat box, or if you would like to unmute yourself and ask a question, then you can do that as well.
This is Frank. I'll just interject something here if nobody else is coming in yet. Obviously, it's just remarkable that the prevalence of COVID in some of the tropical countries like Sierra Leone is so low at this point compared to more temperate regions. And from what I've read, very high heat and humidity seems to at least somewhat prevent the COVID strain of virus from spreading. But is that sort of the thought as far as some of the countries, and of course, the heat and humidity and the lowlands of the tropics is very, very intense. And is that sort of the thought, or is it just that they haven't really had much testing?
Thanks, Frank, for the question, and I'll let Sheku jump in on that as well. And I can just say, from this side, it's hard to say, right? Because every country has responded in a different way, so it's hard to know what has actually led to the impact of like having fewer COVID cases. But there was Sierra Leone had very early lockdowns, and they were very strict. And so they, essentially, and this was operationally challenging, but the airport closed with 3 days notice, the international airport, and they just stopped traffic coming in and out. And then there was a lockdown between districts, so people weren't able to move outside of the district that they were in. So again, there are other challenges that happen because of that, including food security and ability to keep food prices steady. But it's hard to, I think that definitely the response had something to do with the success now. But Keku, what's your feeling with your ear to the ground?
So I think as part of the strategy implemented by the government, I think we are lucky to have a kind of like a proactive leadership and taking the COVID situation much more seriously. And I think that was very, very helpful. Also learning from the impact of Ebola, that's how it affected our communities. So it was very, very easy for communities to easily accept that COVID is real and it is inexistent and it is killing people. So part of it, even before we could register a case in March, the government was almost ahead of its game by ensuring that there is a lot of education going to the communities, and there is a lot of kind of like engagement with community members, as well as from our part, from OneVillage partners, we are also very much engaging with our communities, making sure that people actually take it very much seriously, which was very helpful. So the government was able to come in easily to put out those lockdowns to ensure that people movement are restricted by district or by villages. And also, we also have the traditional kind of authorities that we are also very much helpful in making sure that the communities were safe. So we have the community authorities who are able to organize themselves. Like for example, the Federal West where we worked at, we had the farmer chief quickly moving forward to form task force groups, and so those task force groups were made of individual community members who are young people that were very active, and they were at the forefront to ensure that they respond to situations as needed based on the government regulations. That was very helpful in making sure that we continue to keep the rate of growth low in our country.
Thank you. I'm going to pass the next question from Jackie to you and ask if you can maybe slow down just a little bit because your connection isn't really strong. So that'll help us to understand you better. The question from Jackie is, what specific things are the communities doing that have led to better harvests and more food security?
Come again?
What are the communities doing to have better harvests and improve their food security?
Yeah, I think this is a kind of like a two-way approach to this, because we have had a situation where communities were kind of like take off the hook because they do not have much work going on to ensure that they impact on farming activities. So this is something that a lot of institutions or organizations are talking about currently, that it's going to affect long-term food security in those communities. However, our communities are much kind of like lucky because we are already doing some agricultural projects. We are in communities we are creating a seed bank, a revolving seed bank that farmers can learn from and continue to farm. Also, on a broader aspect, we have communities currently mobilizing themselves into groups to ensure that they work on group farming, and the Ministry of Agriculture is also very supportive, making sure that they provide seeds to farmers so that they can embark on farming. But there is something that is very kind of like exciting among our communities. because of the consolidation of cohesiveness. It is very simple for them to come together and make sure that they are planning for how they want to see the future when it comes to food security. So this is a complex kind of situation to talk about, but however, communities have been able to do it in their own way by responding individually as well as based on group to actually ensure that they are doing more farming and making sure that they are saving more seeds for planting next year.
Sheku, we have another question for you from Maggie. She's excited to hear about the birthing center and wondering if you can talk more about the services that are provided at the birth center. Does it have skilled health workers, and do the mothers come to the center to give birth?
Yeah, I think part of the reason why the communities are very fascinated and excited about the birthing center is because they want to minimize constraints when it comes to moving correctly from one community to another community in order to kind of like give birth to their children or even have access to medical services. So, and what this community, they are communicating, they already have a clinic facility, but that clinic facility was long ago without providing more, improving on those facilities that are currently in the community. So the community is currently constrained when it comes to when people are sick, how do they get improved service delivery? How do they get nurses that are well trained to take care of the community? And a lot of these people, because of the constraints that they suffer from, they resolve to actually seeking redress using herbs, traditional herbs at home, and also many of them do not actually go to the current clinic to take for any service delivery. So as part of the community, what the community is anticipating is to improve on those facilities currently, like improving on the labor room so that people who are supposed to give birth can give birth safely. They also improve on the postnatal antenatal kind of room. The structure itself is not only what they really are looking for, but the services that they will be able to have in that structure. That is what is very key. Like having access to medical personnel who are well trained and who will be ready to provide services in that community for people. So they really want to also improve on where, when people deliver, where they can have some rest to get more treatment from the medical professionals. Because currently, when people deliver, because of the size of the room, it's only one bed that they are using. So when people deliver, they have to be forced to go home, even when they are not healthy. So with this improvement, now they'll be able to have more beds in the clinic structure that mothers or pregnant women can use to have improved service.
Thanks, Shigu. And I think, you know, some of you might know this, but some of the communities that have focused on health services and birth centers in particular have really done so because people are not going to a health clinic until they're in critical need of health services. So a mother could be in labor and she's not actually going to the clinic until she has an emergency, or she's not going to the larger clinic with more services. And that has caused people to give birth or pass away en route to the clinic, or giving birth on the road. And so it's a huge problem in a lot of the communities that we partner with. And so by having the clinic and having somebody locally who's trained to assist with delivery and making sure that that's accessible, it just can make a huge difference for the mother and the child, and it being able to have a healthy start.
Yeah, part of it also is the distance that people have to cover to go to the nearest improved service delivery, which is actually constrained with the road network, very hard and difficult to access. So this is all adding to the burden on pregnant women or children that are in need of the service. So having those facilities in their community will help us to improve the overall well-being of that community.
Well, thank you everybody for the questions. I just want to wrap us up with a final few words on how you can support OneVillage Partners. So many of you on the call are such generous supporters of OneVillage Partners, and we're just really, really grateful for all that you have done to support our organization and our partner communities and helping to change lives for 24,000 people in Sierra Leone. So how you can support, we, despite having a very great turnout early in the year and people were really generous with their COVID response, we're still $100,000 short of our fundraising goal this year. So if you're able to give a gift, if you're able to give again, we really appreciate your support. It goes a very long way. Please engage with us on social media. It is Giving Tuesday, so we have emails going out. You can forward those to your friends. You can share those on social media and get the word out about the work that we're doing and the community-led approach that we have to ensure that we do development with dignity and with sustainability. And finally, I hope you'll join us for more town hall sort of meetings. We're hoping to do more of these in 2021 and perhaps get more specific into talking about our program, individual programs, and having conversations around those. So thank you all so much. Really great to see you. We just can't express enough gratitude for all of your support and for spending some time with us this morning. Thanks, everyone. Bye.